Hello and welcome to Catamount Community Connection. I'm Brian Collamore and host the 1 hour program each and every Sunday. And we call the show Catamount Community Connection because we enjoy speaking with community leaders from all sorts of different landscapes, business, professional, nonprofit, and political arenas. Our program brought to you by the Rutland County Agricultural Society, which has brought you the Vermont State Fair at Rutland since 1846. Had a tremendous turnout this year at the fair, and we're already looking forward to the 179th fair coming up next August 2025. So we are going to be joined today on the program by Mike Gardner, who is the CEO of Community Health. And before we get into exactly what that is, normally, Mike, when we have someone on for the first time, we enjoy hearing about them personally. So kind of your bio, how you arrived at the position you're at, where you're from, where you grew up, all that kind of stuff. So first of all, welcome in. It's great to have you here with us today.
Great. Thank you, Brian, so much for having me on. It's a pleasure to come and talk to you guys about a very important topic here in Rutland, and that is healthcare.
Yeah.
A little bit about me. I've been with Community Health for 20 years. I'm a lifelong resident of the area. I grew up in Castleton, was a patient of one of the community health centers over in Castleton. My entire family, my children, my parents, my friends, all patients. So I know the community well, care about the community very much. How did I get to working with Community Health? Well, I went to school many years ago, got a degree in accounting, and decided I wanted to get involved in working in accounting. I ended up landing a job with Community Health back in 2004, where at that time, there was 3 practices, Castleton, Brandon, and down in West Paulet. 3 primary care offices, fairly small, that were owned and operated by the hospital. And they were losing a significant amount of money every year, about $3 million a year they were losing. And they realized they couldn't continue to operate losing that kind of money. So they looked into separating from the hospital and forming an FQHC, Federally Qualified Health Center. So that's a status that is a federal designation. And what are the benefits of doing that? More reimbursement. We get better revenue streams from Medicare, Medicaid. We get grant funding. And there's, various perks that the federal government gives to us to help us keep the doors open. So that's when I came on. I came on as the CFO. I'm a finance guy by trade.
So you left, you grew up in Castleton. Where'd you go to high school?
Fairhaven.
Okay, so you're a Slater.
Yep.
And I assume you left the state to go for college or university somewhere, right?
I did. I went to college down in Lynchburg, Virginia, Liberty University. Yep. Where I got my 4-year accounting degree.
And then you decided to come back immediately, or did you do something in the interim?
I pretty much came back home.
Okay. And you've been here ever since, so that'll help people sort of understand, because we talk to a lot of people who have come from other places, and that's great too, but I always have sort of a warm spot for people that were born here, grew up here, did leave for whatever reason. I have a son who left for school in Florida, but also came back. Kind of, the grass is greener kind of thing, go out and see the world, and then decide to come back. So it's great that you're here. So we're talking to Mike Gardner, who's the CEO of Community Health. And I think it might be helpful for people to understand, because as much as, and I was on Health and Welfare Committee in the Senate my first term, and I thought I kind of understood all the acronyms and all the different players, if you will, in the game. But I'm going to rely on your expertise here, because I don't understand necessarily the difference between, you mentioned the hospital and community health, and there's other, I'm sure, people that are doing similar kinds of work. So what is exactly community health?
Community health is an organization that provides primary care.
Okay.
We provide a full range of primary care. So primary care, is really two components. When you get sick, you go see your primary care doctor. They help you get better and you go home. The other component of primary care is preventative care. That's, a very important component of it in keeping people like you and I healthy, going in, getting your annual testing done and your preventative procedures done. And the hopes of doing that by investing money in primary care is that's going to save money in the long run, where we've been going, taking care of ourselves, getting things checked out, and we don't end up unexpectedly in the hospital with problems. So also included, it's not just that component. We have a full range of services in, things that we didn't back 20 years ago, but as our status, we also provide a full range of behavioral health services, substance abuse services, counseling. We have 2 dental practices, so we've incorporated that in. Dental care is really a very important component of overall health as well as behavioral health. We have pharmacy services. We have a in-house pharmacy up at our site in Brandon. And we work closely with all the local pharmacies to be able to provide that service as well.
Okay. Were the original 3, you mentioned Rutland, Brandon, I think West Paulet?
Yeah.
Are they part of community health now?
They are.
Okay.
So those were the first 3. Back then, we had 60 employees, did about 60,000 visits a year. And over the 20 years, because we had financial struggles, we found that the only way that we could take care of that problem of losing money was growth. So we are now up to 10 locations. We still have the original 3. We built a facility up in Shoreham. We took over the Rutland Primary Care site here in Rutland. We merged with the Pediatric Associates Practice. We just built a new facility up on 231 North Main that is mostly behavioral health, but we're also expanding there probably within the next year, where we're adding on a new service line for geriatric care. So that's something really no one 100% focuses on that now, and that's a growing need.
Yeah.
You and I are going to need that someday.
Oh, yeah.
But we have an aging population, and we're really trying to provide that service. Another service we provide, a spinoff on that, is we've started a dementia awareness program where we have a support group, and it's really focused on helping the family members and the caregivers. We have a new program. We're a certified diabetes education center, so we have resources for that. So we really have a wide range of different services, and we're still growing.
2 of the states, by the way, we're talking to Mike Gardner, the CEO of Community Health. Maine is the oldest state in the country, from what I'm able to find out here, and Vermont is number 2. But interestingly, we are now tied with Florida as the second oldest state in the country. And I have a feeling that you might see some of the former Vermont residents now in Florida. I mean, it seems to be where people sort of, to where they migrate. But interesting. So, yeah, you're right. The geriatric program, which for many years was probably overlooked, or at least the focus wasn't on them. And I think same for the dental piece. It's often not included in that sort of overall health situation, but it is now. And I'm curious, and I know I want to talk about the gold award that your group just got, but I want to also get a little bit clearer picture of how you fit in with the Rutland Regional Medical Center and what they offer. Is it a complementary kinds of situation, or are you really part of the hospital? I'm still trying to sort of get a clearer picture of that.
We officially legally separated from the hospital 20 years ago.
Okay.
Still to this day, I have people come up and say, "Oh, you're part of the hospital." So we're our own legal entity. We have our own board of directors, but we are very, very close partners with the hospital. So when we separated, we lost money for 10 years still, and the hospital subsidized us. Why did they subsidize us? You have to have primary care to work with the hospital. So like I said, we're great partners. We provide primary care, and we refer our patients very often to Rutland Regional because they employ all the specialists. Cardiologist, endocrine, all of the VOC, all of this. So they're all partners with us, and we work together. It's not just the hospital, though. It's Rutland Mental Health. Mm-hmm. We're close partners with them. Visiting Nurses Association, the BIADA, care that's done. Rutland's a special community, I think, because we all do work together. I've never felt like we compete against each other. When it comes to primary care, there's a couple private practices still in Rutland. I don't feel like we compete with them. We provide 85 to 90% of the primary care, so we're the largest player. But again, Rutland's a special community. I think we all are working together to make sure that there's health care there for our community.
So we were very fortunate, I want to say 2 or 3 weeks ago, to be able to talk to Judy Fox on this show. Mm-hmm. And she did a great job explaining some of the issues and challenges that Rutland Regional is facing. And I know there are 14 hospitals in the state. I want to say the great majority of them are losing money. They're not necessarily a for-profit situation, but they are losing money, and you don't want that to be happening either. Rutland is in a little bit better situation, and I know there was a report that came out that we want to talk about at some point here today. Oliver Wyman did a report, and Judy had the whole Rutland legislative delegation at a meeting probably a month ago now, and we went over a lot of that. And I did see the presentation actually by Mr. Wyman. So we're going to talk about that as well in just a second. So I'm seeing this as sort of complementary services. You mentioned your location up on North Main Street. My primary care person, I think, is right next door to yours, Patty Thornton, and she does a wonderful job for me. And you're right. I've now begun to get sort of twice a year examinations. They do the blood draw and look at that, and she makes excellent suggestions about, well, your cholesterol level's up, here's what you could do about that. Your weight is either good or not. Usually it's okay. And here are some things to work on there, because you're right, it becomes way more expensive if you have to depend on going into the ED at Rutland Regional. That's not where we want people to to wind up, if at all possible. The preventive piece of this is really, really important, I think. And you've been recognized for that. So if you don't mind, Mike, let's talk about the Health Center Quality Leader Gold Award. That's a big mouthful. And you are now, as I understand, in the top 10% of the FQHCs in the country. And that's quite an honor.
Yeah, so proud. This is the first year that we achieved the gold. Prior to that, we were silver in the top 20% for many, many years. So, there's a lot of things we have to balance in primary care. Financial is one of them. And, part of the way that we balance that is we see as many patients as we possibly can. Because that's what keeps the lights on. That's what we get paid to do. If you can't just focus on that, though. So we equally put a priority on the quality of the work that we do. Dr. Brad Berryhill is our CMO. He's been doing this a long, long time. He, sees patients, but he also oversees the quality of the work that we do. We sit down with our providers, and we have all kinds of data that we look at to see what are we doing well at and what are we not doing well at. And we've made that a priority over the years. To explain those scores, they look at primary care preventative scoring to see how are we doing with getting patients in to get their, different screenings and having their physicals. How are their blood pressure ratings? A whole range of scores. And we, like you said, we are this year in the top 10%. There's 1,400 FQHC entities throughout the United States, and we're in the top 10%. So very, very proud of that. And, the hope is that has long-term benefits for our community, that we're providing that preventative care, encouraging people to come in and do it, and that will have long-term benefits for our patients.
Are there any other Vermont entities that also placed high on this? Yeah,
there is one other very small FQHC. I think there's 11 of them in Vermont. There's a small one down in Arlington that also got the award. But, they do great work, but they're small. It's a lot easier to hit gold when you only have one office and they have like 4,000 patients. Last year, we had 47,000 patients with 10 locations. So to try to have a program when you get that big, it becomes challenging to be able to, keep track of everything. I think there may be a couple others that maybe got silver. But we lead. Not only on the quality do we lead, but our efficiency. Very important about how we've been able to grow and make money, invest that money back into the organization to give more services. So the amount of visits per provider, the amount of visits per dentist, the amount of visits per mental health staff, we lead the state average and we lead in the federal average. So those two key areas of our efficiency and the quality, we've done very well. Lot of good work being done.
It's interesting, and this may or may not be a good analogy, and you let me know. We're talking to Mike Gardner, who's the CEO of Community Health here in Rutland. And I've never actually owned a restaurant, but I understand sort of how parts of that work, and you mentioned the efficiency factor, and they used to talk about table turns. So you have people come into a particular restaurant, sit at a table, have food, and the faster you can turn that table, so in other words, they've eaten, they've paid the bill, and they're gone, and then they're replaced by the next customer, the better off the restaurant is. Obviously, Sure. You don't want people sitting there for 5 hours drinking coffee because you're not gonna turn a profit that way. Is it a similar sort of thing? Again, I'm not suggesting that you just have sort of this quick, hey, I'm going to see you for 10 minutes and then, you're gone kind of thing. But I have to think that part of the efficiency factor would be the ability for a provider to see a patient and not necessarily spend an inordinate amount of time with that patient unless it's needed.
Yeah, absolutely. That is something that we're always looking at in ways that we can improve it. If a patient came in and could sit with the doctor for 2 hours, they'd probably get great care.
Yeah.
But we wouldn't be able to afford to keep the doors open. So there is definitely a balance there where you try to become as efficient as possible. You want to make the experience of the patient good. You don't want the patient to feel like, the doctor saw me for 2 minutes and left and I don't even know what's going on.
Yeah.
You can't have that. And then you can't let the quality of the work, be negatively impacted because all you're thinking about is pumping patients through the clinic. So, to give you an idea, it varies between provider and dependent on the complexity of the visit that day. Our providers will see anywhere between 15 and 20 primary care patients a day. It depends. But my job is to do everything I can to make them as efficient as possible, give them all the support that they need, using technology to make things, run as smoothly as possible. And, there's always room for improvement. We're always trying to look at ways where we can do things more efficiently. Technology is going to change healthcare with AI.
Yeah,
I can talk a little bit more about that.
Yeah, we're certainly going to get into that because I know that telehealth is also, in its infancy, if you will. And I hesitated to use that analogy because I didn't mean to imply that this is sort of an assembly line type of situation where you're just turning patients over. But I assume part of your job is to see, you take a 10 or 12-hour day or whatever it is, and you divide that by the number of patients that a particular provider has seen, and then there must be some sort of quality rating or answer on the other end of it that people still feel like, yeah, boy, I got my money's worth because I've got a good doctor that's looking after me kind of thing. So I guess there's a balance there, right? Oh,
yeah, absolutely. And we monitor it, too. Not only the quality scores, but we do patient satisfaction surveys.
Yep.
They go out all the time, and we want to hear from patients what's working well and what's not working well. And I look at those scores, and we get 95% approval rating. You're never going to get 100,
right?
Because we're not perfect. We occasionally make mistakes. But patients will reach out if they have a bad experience, and I want to hear from them because I want to do whatever I can to make the experience for them as pleasant as possible. Many times when they come in to see us, they're not feeling well.
Yeah.
So, it's our job to make that experience run as smoothly as possible.
Well, 95% puts you in the top 5%, I guess, right? So you never know. And is this a yearly award?
Yes.
Okay.
Yeah.
So each year, all of these entities request at least consideration for the award, and then who decides who gets what?
Well, we're required to report to Washington, D.C.
Okay.
HRSA is the agency that we report to. So we are required to report to them all kinds of different data. They want to know how we're doing. Why? Because they give us grant money every year. We get about $2.7 million a year to support our organization. So they want to make sure that money is being spent well. And every year we report to them. Every 3 years they come on site and spend 2 days and look at everything to make sure that, and we've always had very, very positive results from those visits.
Okay.
So
we're going to take a break here, and we're again talking to Mike Gardner, who is the CEO of Community Health, and we'll take a break here on Catamount Community Connection, and we're coming right back. Welcome back to Catamount Community Connection, our 1-hour weekly public affairs program here at Catamount Radio. I'm Brian Collamore, your host, and this week we're talking to Mike Gardner, who is the CEO of Community Health, and we began to talk a little bit about IA and also the telehealth services that are now available. Community Health implementing information technology practices that will enhance the quality of the services. And we, again, talking about telehealth, collecting data on patient social risk factors, and all kinds of other information that is very, very important to get a handle on. And Mike, I know you want to talk a little bit more about that.
Yeah, thanks. As I said, I believe there's big changes coming in healthcare with the use of AI, artificial intelligence.
I think I said AI.
Yeah, we know what you meant.
Yeah.
But yeah, I mean, you probably see on the news and see on the internet, there's all kinds of new products coming out there that are amazing. How would that be used in healthcare? Right now, we use an electronic medical record. When a patient comes in, the provider comes in with their laptop, and they document everything that's going on with that visit. So that is very, very time consuming for the providers. The biggest complaint that I get for burnout is the amount of time they spend looking at the computer screen, reviewing labs and documenting what's going on in the visit. If they've gone to see a specialist and the specialist sends back the report, they have to review it. The primary care provider is really the captain of the team when it comes to the patient's care, because they look at all of it. And it's very time consuming. So how will AI work? I've seen demos of this where the patient and the doctor are in the room, and the doctor's not going to type. He's going to set the computer down, turn it on, and the AI will record the entire conversation, and it will take out the pieces of the discussion that don't matter. So if you go in and you're asking your doctor, hey, what did you watch the football game last night?
Yeah.
We don't need that in your medical record.
Yeah.
So the AI is smart enough to know of what's being talked about, what belongs in the medical record and what doesn't. And it takes a huge amount of time off of the doctor to spend typing that information in. It's not expensive technology. And I think the possibilities that are out there with it are amazing. I see maybe 3 to 5 years down the road, the AI will also be smart enough to be able to look into your chart for you and pull out the information that's relevant that the doctor needs to talk to you about. So he's not spending time clicking with the mouse, going through all the different aspects of the chart, where the AI will say, oh, Brian came in and he needs to have, this test or that test, or it's time to get updated on these labs. And it'll be a tool to help the doctor, manage your care. So that's new. We're just looking into that now. What's some of the technology we've used in the past? Telemedicine became really big during COVID. And we don't use it a lot in primary care, but we use it 50 to 60% of our behavioral health visits are now done via telemedicine. That's been a big win for everybody because it saves the patient from having to drive into the clinic. It reduces our no-show rates. If someone forgets and doesn't come to their appointment, we can reach out to them and say, hey, would you like to do telemed instead? So that's been a very successful addition of that service line.
Is there a possibility that AI would eventually be able to become sort of a coding expert? You're getting reimbursed by Medicaid and Medicare, and I assume that someone is sitting at a desk somewhere pushing paper around with codes in order for that reimbursement to happen. Is that something AI could eventually do?
Yeah, absolutely. Our electronic medical record has the ability to help us suggest which medical code to use to bill. There's thousands and thousands of codes.
Well, naturally. We make things as difficult as we can.
Yeah. So, there is already technology out there right now that does assist with that type of thing.
Hopefully that doesn't mean that whoever that person is now will unfortunately have to leave and not have a job anymore. You'd like to keep those people there. But to me, and I don't want to make too much light of this, but it's sort of a trivial exercise, if you will, that is not particularly probably stimulating to people to just continue to fill out form after form after form. So It would be good to have AI do that, and maybe that person could do something else, and help somebody else out.
Yeah, absolutely. I'm not worried at all about AI having us take jobs away. It's the opposite right now. I think you probably hear this from a lot of people in a lot of different industries. It is hard to find people to work. We have a shortage
we do.
of staff. I know it's that case in many industries, but we are definitely feeling it in the healthcare industry, the hospital as well. Shortage of nurses, shortage of staff all across the board. So that's why I think it's important to use technology to help us become as efficient as possible without actual human beings doing it, because it's so hard to find people to come and work.
Mike Gardner is our guest today. He's CEO of Community Health, and I'll just read from your award, Community Health, for people that are just joining us. It's Vermont's largest FQHC, which is, again, the federally qualified health center. It's a network of primary care, pediatric, behavioral health, dental, and pharmacy services. And they have offices in Rutland, Brandon, Castleton, West Paulet, and Shoreham, and then dental offices in both Rutland and Shoreham. And we could talk a little bit more about your locations and where they are, and whether, I guess at one point, whether an additional location might help kind of spread the costs around a little bit more, or become another sort of center of revenue generating situation. But again, I want to go back, because we started to talk a little bit about the Act 167, which the Vermont legislature passed, I think, in the last biennium, which, often, I shouldn't probably get too negative about this, but oftentimes when the legislature has no idea what else to do, they commission a study to look at a particular problem and, hopefully get more information in order to come back with, a common sense solution to a problem. Sometimes it just seems like we keep kicking the can down the road, and we do study after study after study. The educational system is one of those where we've done, something like 30 studies about how we pay for our educational system. And to date, we haven't figured a good way to do it because the property taxes keep going up. Anyway, that's a whole other discussion we could have. But you were on the board, I think, or on the committee that was part of that group that was going to study this, right?
Well, I serve on the board of directors for the hospital.
Okay.
So I'm pretty aware of the study, but like you said earlier, healthcare is so big, so complicated. I've been in the business for 20 years, and there's still components of it that I don't understand. Yeah. So I can't imagine, being up in the legislature with everything you guys have to look at and to be able to understand all the ins and outs of healthcare. So they came in, they spent all this time doing this study, and the results have come back. And, the way I read it is they realize that we don't have enough money to pay for healthcare services. Like you said, many are losing money. We're losing money right now. And we can't continue to, we can go a little while without losing money, but at some point we're going to have to make some drastic changes. And the results of that study sounds like a lot of it has to do with cutting expense out of the system. What does that mean? It means cutting people out. And when you cut people out, that means cutting services out. I think it's more directed toward hospitals because that's where all the money is. But if they were to cut expense out of Rutland Regional, it will impact us because we rely on them to have the specialists that we refer our patients to. And if they have to cut services or make the waiting time longer to go see that specialist because they don't have enough people working, it's going to fall back on community health. We're going to have to help, try to take care of these patients that's not our expertise, is the specialist services. So I'm very concerned about it. It's not just in Vermont. As you know, I think it's nationwide. We have looking down the road, we are going to hit a brick wall at some point where healthcare is something that we all rely on, and it's very expensive. And if we're not funding it appropriately, who knows what will become of it.
One of the suggestions that I can remember, and I believe this was in the Wyman report, and again, 14 hospitals in the state of Vermont, the great majority of them are losing money every year. One of the things that came out of his report that I can remember was at least a suggestion that if you are interested in a particular medical procedure, that instead of each hospital trying to offer everything, that there would be one or maybe two, maybe in the north and the south part of the state, that would offer a particular service, a specialty, if you will, and that would free up the others to find what they were really good at, so that we would have a series of different, I guess, opportunities for people. It would unfortunately mean more of a travel for a lot of patients. They'd have to get in a car, and instead of being able to get it at RRMC, they'd have to go to Burlington or maybe somewhere else. And I don't know whether that's something that the health industry would want to do or not. It seemed to make some sense to me, if it's very carefully done, that, again, you don't have everybody trying to do everything, that you do have specialty things. Much the same as the suggestion in the educational world that a VOTEC situation, one of them would do this, and then if it's in Addison, and then they wouldn't do that in Rutland, but they do something else in Rutland that Addison wouldn't do.
Yeah.
So that was one of the suggestions that he made that I thought at least you could make a case for.
That concept makes sense. You look at it, yeah, that makes perfect sense. However, you're going to have some people that are not happy about that.
Sure.
The example of having to travel. And then if you've got, certain service areas that are now providing certain services, and we say we're no longer going to do that, what does that mean for the people that currently have those jobs? It's really that's like turning the whole system upside down and trying to rebuild it the way that it should be. And you're going to have winners and losers in that. This is not going to be easy. His,
I don't know if it was the ultimate decision or whatever, was that if we keep going the way we are, as you mentioned, it hits a brick wall at some point, and the services won't be available at all. And I guess you could certainly make a case for that too. So yes, it will take a fundamental structural change in the way that healthcare services are offered in Vermont. If you take his suggestion about sort of the specialization pieces of that, and then you marry that, if you will, and I know you don't have to answer to the Green Mountain Care Board, but the hospitals certainly do. When we first, and I was there when we first created the Green Mountain Care Board, Kevin Mullen, who was a local senator at the time, and then later was the chair of the Green Mountain Care Board, when it was first created, it seemed as though there was a little bit less friction between the hospitals and the board. Lately, it seems like that tension has increased dramatically. And I know when Judy Fox was on with us, there is serious concern about some of the decisions that were made recently by the Green Mountain Care Board, namely that Rutland itself, the Rutland Regional Medical Center, would have to cut over $6 million in revenue, and yet somehow still be expected to grow. And to me, that doesn't make any sense at all. And UVM Medical Centers, even in a worse situation, because the money involved is millions and millions and millions.
Yep.
So I certainly am sympathetic and appreciate Judy's concern, and I think I'm hoping that the Green Mountain Care Board can at least take the information that they're getting, that sort of pushback, and convene again and maybe make a different decision.
Yeah. Community health is very fortunate. We don't have to deal with the Green Mountain Care Board. Most of our oversight comes from HRSA down in Washington, and Montpelier Medicaid is a big piece of our revenue. And right now we are working with the state to try to negotiate higher reimbursement for primary care. You're aware of that.
Yep.
But there's only so much money that goes around, and the state has to prioritize many things about how are we going to use the resources that we have. I really hope that that we put healthcare at the top of the list. That's something that there is no party side on that. We all rely on it. But again, these are hard times.
Is the Medicare reimbursement rate a little bit better than Medicaid? And what kind of hole is left after you get the reimbursement? If it's obviously they do 65, 70%, there's 30% that you got to look for somewhere else.
Yeah.
What's the landscape there?
Our best payer right now is Medicaid.
Okay.
Medicare is second, and commercial insurances would be last. None of them pay our cost. So our cost per visit, I'll throw some numbers out.
Yeah.
It's about $250 a visit is what it costs us. Our reimbursement averages around $200 a visit. So you think about it, every patient that comes in, we lose $50.
Yeah.
Now, we do have other revenue sources that help fill that hole. And in the past, we've had enough to show a positive bottom line, take that profit, reinvest it, and continue to grow the business. Since COVID, we've lost money. Why? As you know, our costs skyrocketed after COVID, inflation, staffing costs. Our second biggest expense is our health insurance expense for our employees. We all know that goes up astronomical amounts every year. And we finally got to the point where the increase in costs and the revenue that we get, they crossed lines, and now the cost is more. And it's not because we're inefficient and we have a bunch of fat in the system that can be cut. We don't have any expense that we can cut without cutting services. So we're really working on negotiating to get that reimbursement up so we can continue providing the services. And like you said, we're always looking at ways that we can grow, provide more care, and spread the expense over a bigger piece of the system. And so that's some things that we're looking at. We're still looking at growth to try and help balance the bottom line.
I know when we spoke with Judy Fox, they're in a position where if that cut happens, they were talking about maybe, I can remember when the first MRI machine made its appearance at Rutland Regional, everybody thought they died and gone to heaven, and they were going to get a second one, which won't happen if this is stood up. The other service, that dialysis, is also threatened to go away in Rutland if this happens. So I really think that we need to take another look at the way that that decision was made. Maybe the legislature has to sort of pare back the authority of the Green Mountain Care Board to some degree. Because again, when I first started to mention this, when Kevin Mullen was there, it seemed as though everybody was sort of on the same page. Yeah, they were kind of sitting on top of the hospitals in terms of approving budgets every year, but it wasn't as contentious as it seems to have gotten. And I just hope we can find a solution, because it isn't a particularly pleasant situation to think that Rutland Regional, which is the second largest medical facility in the state, is going to have to cut back on services that right now are critical for so many people. It just I don't know what the answer is either, Mike, but we got to keep working at it.
Yeah, totally. Yeah, really, I think what changed, the big change that happened, is the pandemic. And ever since then, things have really started going the wrong way, with costs going up and reimbursement not keeping up with it.
Okay.
And if reimbursement's going to keep up, well, what does that mean? It's got to come from somewhere. Medicaid and Medicare are a big piece of the amount of reimbursement that we get. And Washington and Montpelier neither want to raise that amount because it's a lot of money.
Yeah.
And it could mean having to raise taxes.
So our commercial insurance landscape is also a bit tentative at the moment. I believe we have Blue Cross Blue Shield and MVP are the only two that are left, not providing a lot of competition, which I believe is a good thing. Normally when you have 3 or 4 insurance companies battling for business, you can at least make a pretty good guess as to where the rates are going to go. I'm hearing again that MVP, I think, is probably going to leave Vermont. They have 1-year extension, I think. And so for folks with the ability to pick and choose, they're going to be left with one company, or they have to go somewhere else and find insurance. So that's another piece of this that it's tough. It really, really is tough. You know, we passed a bill last year, the prior authorization situation, where, again, you had doctors and their staff literally sitting and filling out forms rather than seeing patients. So we thought we could make things a little bit easier for them, but it opened a whole new door with the commercial insurance providers that they don't want that to happen. They weren't very happy that bill passed. And in fact, that was when the lobbyists for MVP at the time said, if you do that, we're probably going to have to leave Vermont.
Yeah.
They have way more customers in New York State. So, you know, you talk about balance, and it really is a tough battle right now.
Yeah, totally. You know, as far as that legislation that you just talked about, thank you for that, because that did help us. We do have people that would do nothing but sit on the phone, filling out forms to get pre-approval for things that, why do I have to go through this process? Why would you ever not approve, you know, this emergency MRI or whatever the test is? We spend so much time, so much money on things that don't have anything to do with healthcare.
Yeah.
And it's so, you know, disturbing that we spend all that time and money on it. But I guess that's the way the system is.
Yeah. I mean, if everybody was absolutely always honest, you probably wouldn't need to have all this pre-authorization. But my guess is somebody gamed the system at some point, and the insurance company said, well, we got a solution for that. You won't be able to do anything until we tell you ahead of time that you can go ahead and do it. So,
yeah,
you know, I wish everybody could be a little more honest, I guess. But maybe that's reaching for the stars, too. We're talking to Mike Gardner, the CEO at Community Health. We need to take our second break here on Catamount Community Connection, and we will be right back. Welcome back to Catamount Community Connection, our weekly public affairs program here on Catamount Radio. I'm Brian Collamore, your host, and our show is brought to you, as it is every week, by the Rutland County Agricultural Society, which has brought you the Vermont State Fair at Rutland since 1846. Believe it or not, the 178th fair, just concluded back in August, was very well attended. And on behalf of the trustees of the Rutland County Agricultural Society, thank you all for your attendance this year. Perfect weather, clean buildings, clean environment. It was just super. And we're already looking forward to the 179th Vermont State Fair here at Rutland. We're talking to Mike Gardner, who is the CEO of Community Health. And I know one of the locations, and I think I counted either 15 or 16, Mike, the Stratton Road location, Community Health of Rutland, is your largest one, right?
Yeah, it is. We took that site over back in 2011. It was private practice, and they decided to join us, and it's grown. And since taking it over, it's become our largest site. It's also been our most challenging site. And why is that? Because we're having a hard time recruiting primary care providers. After the pandemic, we had 4 or 5 providers retire or decide to leave the area, and it's very challenging to recruit providers. So Unfortunately, we had to stop accepting new patients. And I think we're close to being able to start accepting new patients at that site again. We were able to hire 4 new primary care providers this past year. We've got a couple more that are coming on. And at that point, we will be full. But we still feel like there's still room for growth at that location. So we have a strategic plan to be able to renovate that site, add some additional space on, and maybe have room to hire 2 to 4 more providers. So we're always looking down the road to make sure that we're doing everything we can to be there to meet the need. And that's the one site that, has been a priority to get things stabilized there.
My guess is there's an intersection, as there is for so many businesses, between finding housing for people that want to come up to our area and work, and their ability to find a house that they can afford to buy or even rent in order to do that. And I know Judy Fox talked a lot about, I think it was an X-ray tech that they hired and even came up here and began work, and then had to go in front of, I don't know if she talked to the person or it was the board, but that person had to leave because he couldn't find a place to live. So There has been some good news. We had a press conference last week where the Treasurer's Office, Mike Pichek, our Secretary or our Treasurer, State Treasurer, has given $8 million to basically Heritage Family Credit Union to make loans available. Some of it will, and I think it was a $5 to $3 million split between rehabbing current structures, which are not habitable at the moment, and then building new ones. And so that will, and as if I remember right, they're going to make the loans available at 3.5%, which is way better than what the conventional 7 or 8% loan rate is now. So that will eventually, it won't be tomorrow, but it will eventually help ease the burden of the housing situation. But I'm assuming that was part of the reason where, you might find somebody that really wanted to do it here and work at the Stratton Road location, but couldn't find any place to live. Yeah,
that has totally been a challenge for us in the past couple years. Not only is it hard to recruit providers, but then when they get here and can't find a place to live, it's been a deal breaker.
Yeah, absolutely.
It really has. So it's good to see that they're finally putting some money into the housing problem. It's definitely affecting us.
We have about 2 minutes left. I know. Let's talk about Express Care really quickly. If you have a choice to make there, and also the dental program that we never really did get a chance to touch on too much.
Yeah, sure. Express Care. We have 2 Express Care locations, one at our Castleton location, one at the Rutland location, which is right down the road from the emergency room. So I just want to let patients know that is an option. If you can't get in to see your primary care provider for, kind of a mild illness, we're not an emergency room, but if you're not feeling well and you can't get in to see your primary care, please don't go to the emergency room and wait for 4 hours. Call Community Health. We are open 7 days a week. We never close, 8 a.m. to 8 p.m. We are there for those acute needs. Also, the dental practice, I wanted to let you know, our strategic plan is to continue growing dental. We have 2 full-time dentists that are slated to start by the end of the year. And again, dental care is a very important component of primary care. And we have a program at our dental offices. We call it a sliding fee discount. Mm-hmm. It's based on your insurance status and your income level. And we are able to provide discounted or even free dental care for patients that really have needs and don't have insurance and the resources to pay for it. Last year, we gave away about $750,000 in free dental care. We changed lives with that because dental can be very expensive. And, part of what we do with our profits is we reinvest back into the organization. But we also help the patients that are the most needy, too, with providing that discounted care. So if you're out there and you've got dental needs, please look up Community Health, because we can get you in and get you taken care of.
Well, Mike, I really want to thank you. I learned a lot in this last hour, and hopefully our listeners did too, about how you interact with the Rutland Regional Medical Center and the other practitioners in the area, and how you're all sort of working together in a complementary fashion to provide healthcare services for the area. Congratulations on the Health Center Quality Leader Gold Award. And you should be proud of your team there. And it's been a pleasure having you on today. And hopefully, at some point, we can have you back and maybe get another update from you.
Yeah, anytime, Brian. Thank you so much for taking the time.
Mike Gardner, CEO of Community Health here in Rutland. Thank you all for joining us, and we'll see you next week on Catamount Community Connection.